So you're about to go on your first clinical rotation. Let's talk about what you should expect to see and what you should be expected to do. There's 3 places that we go for clinical rotations: Dickson County EMS, City of Dickson Fire Department, and Dickson Dispatch, also known as Dickson Central. Those are the 3 places that we use most often for our clinicals. For EMS and fire, they have 24-hour shifts, so we try to align our starts of our clinicals, the beginning of our clinical, with the start of their shift. So EMS starts their shift at 8 o'clock, so arrive by 7:45. City of Dickson starts their shift at 7 o'clock, so try to arrive 15 minutes early at 6:45. With Dickson Dispatch, their transition from one shift to the next isn't really going to help your education as a firefighter or first responder. So we just schedule these throughout. Just try to arrive 15 minutes before your scheduled time. So let's talk about what the purpose is of your clinical. The reason that you go on these clinicals is so that you can learn, create connections, and gain experience. You already have some book knowledge, so you need to learn how to apply that knowledge in the field. What does it actually look like when somebody is diaphoretic? What does it actually look like when somebody is in severe pain or when they're having a stroke? What do those scenarios actually play out as in real life? What does it look like? So apply that knowledge that you have through the experience that you may have throughout the day, and then create those connections. It may be that you never work with these people again a day in your life, but there's a good chance that once you're in this field as a first responder, be it a firefighter or medical professional, you're going to go to classes, go to courses, and you'll see these individuals again. And it's always beneficial to know who these individuals are and who they work for in the county, because as you move forward, that's going to be important in you growing your knowledge and becoming a better responder. So learn, create connections, and gain experiences through your clinicals. When you go to your clinicals, you need to follow all the guidelines that you are given. Before you arrive, you should have already signed a sheet of paper, or you'll sign it when you first get there, that goes over the HIPAA rules and the expectations for the day. It should also cover what you should be wearing. Follow all of those guidelines. Make sure that you are adhering to them. When you arrive, the crew may also give you additional instruction, and make sure that you just follow the rules that they give you. It doesn't matter who you are, if you're related to somebody, or how you know someone. You are not the exception to the rule. You need to follow every single guideline that they give you. When you're at the station, you need to be engaging with the crew. Make sure that you're not sitting over in the corner by yourself and playing on your phone or doing anything along those lines. Make sure that you are engaged with the crew. Help them with their daily task, assist, learn how they do things, be involved. So while you're at the station, be engaged. Assist with those daily tasks. When you first get there, they should be doing truck checkoffs. They'll clean probably the rig, and they'll restock as well throughout the day. Be involved in those different parts of their day. Just help with those daily tasks. It helps build your relationships with them. You're building those bridges, and you're also just being helpful and useful in your learning how they do things, and if it's something that you can take back and apply at your station or your department. So help with all of those different steps. When you're responding to the call, listen to the instructions that you're given. It's probably a good idea when you first get there to ask, when we do have a call, where do you want me to ride? Go ahead and ask those questions when you get there. Listen to the instructions, because depending on what the call is, it may change how they respond or what units that they're taking. And then while you're responding to the call, always make sure that you're wearing your seatbelt. Doesn't matter if no one else in the truck is wearing their seatbelt, you are expected to wear your seatbelt, and you're probably already signed something saying that you will. So as you're responding to a call, put that seatbelt on and go ahead and listen to the instructions that they give you, because they may tell you what they're expecting you to do when you arrive on scene. So while you're on the call, observe, ask questions, and assist. When you first go on a clinical, the first couple that you go on, or maybe just the first one, you may not feel comfortable talking or interacting with that patient. That's okay. But you need to have the intention of, by the time you finish your clinical, you are comfortable talking with the patient. So observe how the crew interacts with patients, how they act, what they're looking at. Look at all of those things. Watch what they're doing. If they ask you to be involved, then get involved. Help with whatever it is. They may ask you to go grab something off of the truck, and you should know where it is, because in the morning when you were helping with checkoffs, you should be figuring out where everything is located. So make sure that you pay attention when you're doing those truck checkoffs in the morning. And then ask questions. They may let you ask the patient a sample history, so you can ask and go through that. If you feel comfortable with it, go through it. They may let you take vitals. They may let you control some bleeding. There's going to be different things that you're going to take part in. Just ask if you can help, if it's something you feel comfortable with. If it's not something if it's something that you don't feel comfortable with, let them know and try to help in another way. But observe, ask questions, and assist them as you can. When you transport a patient to the hospital, they're going to get the patient out of the ambulance. You're going to go into the ER, and you're going to take that patient into a room. Once that patient is transferred, those rooms can be a little small, so you may have to stand at the doorway while the patient's transferred over. Let them get the cot out of the way, and then ask if you can stay in there for them to give report to the nurse. Listen to how they give report. Notice how that transition occurs, how that EMT paramedic is building the relationship between the patient and the nurse that comes in, or the doctor that comes in, depending on what the call is. Notice how all of that happens. Ask if you can stay in there and watch. As soon as that transition has occurred, they've given report and everything starts to move, and the EMT or paramedic is just getting the signatures, go ahead and go back to the ambulance and start helping clean up the cot and resetting the back, because you'll have to clean the equipment and put everything back so you're ready for the next call. Assist with that. And then ask whoever's already cleaning up in the back of the ambulance that you're assisting, ask them questions about the call. Why did they do this? Why didn't they do this? What was the reasoning behind it? Ask what you could have done better. See if they have some feedback for you. And then ask what things were and why they asked the questions that they asked. This is your learning opportunity. So ask as you're cleaning up, okay? And that's what this slide is. Just ask and assist them as you can with the cleanup. So let's just go over a couple do's and don'ts. When it comes to interacting at the station, talking with the crew, that's definitely something that you want to do. Something that you want to avoid is sleeping. You should not ever be sleeping on these clinicals. You may expect, or you may see, that your crew goes in and they go and take a nap, because they're there for 24 hours. So they're going to take a nap in their downtime. That is not okay for you. You're only there for 12 hours. So if they go and lay down, or if they go to sleep in the recliner, then you need to be studying. So you need to find something productive to do during your clinical to further your knowledge, okay? That brings up the phone. It's very tempting to use your phone as a crutch in social interactions. When things get awkward, or the conversation slows, or somebody else pulls out their phone, it's a reaction to want to pull yours out. Do not take your phone out and be scrolling through social media or watching videos or anything that is not educational. If you're reading or something like that, I would still choose to use your book so that they don't get the wrong message. So when it comes to your phone, leave it alone. Leave it in your pocket. Don't get it out. Even if they're using theirs, or if everybody's gone, don't use your phone. If you have to send a message or make a phone call, be respectful, step out of the room. Just do your phone call and then come back into wherever everybody is. That also brings up pictures. You shouldn't be taking pictures while you are on clinicals. There's nothing you should be taking a picture of. If you need to take a picture of the back of the ambulance or something like that, you may do that while you're at the station, but just ask them before you take any pictures. And then something that you do need to be doing is studying. So as it comes up, you need to be studying throughout the day. This isn't your priority while you're there, but during downtime and between calls, and if the crew is busy with other things that you cannot help with or assist with, then you can study. But if the crew asks you to go clean the truck, or if the crew says, hey, we're going to go wash the truck, you need to be washing the truck with them. You need to help them with that. Studying is just a secondary item that you can do while you're there. When it comes to attire, you should already have, or you should already be aware of what is acceptable and what isn't. Some things that are never acceptable, your underwear should never be showing. You should not have holey jeans on. You should not have a t-shirt that has a graphic logo on it that could in any way be construed as offensive by anyone. You should be wearing a plain t-shirt or a plain polo, and then you should be wearing nice, clean jeans or slacks, whatever. It should not be dirty or holey or misconstrued in any way. And then when it comes to shoes, sandals are never okay. It needs to be closed-toed shoes. Boots or tennis shoes would be acceptable. So those are some do's and don'ts. Now, all of this comes down to your actions. When you're on a clinical, remember that you represent your department, your classmates, and your family. So if you do something that's disrespectful, or if you do something that would be inappropriate, it's a reflection on all three of those groups. Don't be unprofessional. Don't make it so that no one else can do clinicals. Don't create bad blood between your department and theirs. And don't misrepresent your family. Be respectful while you're on your clinicals. So this is just an overview of what you should expect when you go to your clinical. I hope you found this beneficial before you show up for that first clinical. If you get to the clinical and the doors are locked, hop on Google Maps, look up their phone number and call the station number, and they'll let you in. But that's all I have for your overview for your first clinical rotation.